The air is colder and drier, and that winter air can play havoc with our skin. Eczema is one of the most common skin issues we face during the winter. Dr. Brackenrich, a dermatologist at Ridge, joins us this morning to tell us how we can manage this irritating yet common skin condition. Good morning. Welcome back.
Good morning. Thank you.
So it's interesting because this was something that just happened recently in our household that we found out that our daughter actually has eczema. So what exactly is eczema, and how can viewers at home know if they even have it?
Yeah, so eczema is actually more of a broad term that we use to describe inflammation of the skin. So actually a more accurate term for this or diagnosis is something called atopic dermatitis. And this is really your classic eczema that patients think about. And so with this condition, it is a chronic condition. It affects millions of people worldwide. And so it's a very relevant topic to be discussing. And usually this is going to present with dry, itchy, scaly skin. It can affect anywhere on your body. And in more severe and more acute settings, it can actually present with blistering as well.
So what exactly causes people to even get eczema?
Yeah, so this is interesting because like a lot of other medical conditions, this, atopic dermatitis is actually multifactorial. We know that there's definitely a genetic component to this. We know that it runs in families and can be passed down through generations. But we also know that there's a lot of environmental triggers that can cause eczema. Some of the more common ones that we see are going to be things like fragrances, detergents, wool clothing. We see that a lot in the wintertime. Changes in temperature, as you kind of mentioned earlier, with these colder temperatures that we're seeing, it's a lot more dry air. So we've seen a lot more flares of eczema as well with these changes in temperature. We also see it a lot with stress. Stress plays a big role in a lot of skin conditions, and this eczema is no different. So we see a lot of flares with patients who are going through a lot of stressors in their lives.
Now, I know that even sometimes babies have eczema, correct? So is this a condition that people will grow out of?
Yeah, so I get that question a lot. And, most of the patients that we do see with eczema initially are going to be those younger patients. And a lot of the parents are wondering, is my child going to have this for the rest of their lives, or are they going to be able to grow out of this? And the simple answer is yes, that there's a very good possibility that they can grow out of this. About 2/3 of patients will grow out of it by the time they're 18 to 20. And so that is a very definite possibility. However, a lot of the patients that we see in our dermatology clinic are going to be more of those severe cases which do persist throughout most of their lives.
So then how do you treat eczema? What are the possibilities of hopefully getting some relief? Because sometimes it just hurts.
Yeah, absolutely. So the good thing is with eczema, there's a lot of research being done on this subject. And so we have a lot of really good treatment options. But I always tell patients that, the treatment really starts at home with them. And I always say that because it really gives them ownership of their condition. And so first and foremost, if they can identify any triggers that they have for their eczema and avoid those, that will be ideal to hopefully cutting back on the number of flares that they're getting. After that, but no less important, is really going to be moisturization. And this is super important to repair that skin barrier, because in eczema, we have an impaired skin barrier, and that creates more moisture loss and just dry skin. And so moisturization is key here. After that, patients can always try an over-the-counter topical steroid. Hydrocortisone is a good option. It's a mild potency steroid. But if those things aren't working, that's really when patients need to talk to their primary care physician or dermatologist about other treatment options. We have a lot of very good other topical medications as well as systemic medications that are very effective for treating this condition.
Now, although these current temperatures we've got going on, and even later on this week, it's not so cold, but typically this time of year it's pretty cold. And so with the colder, drier weather on the way, any quick tips you have for moisturizing the skin?
Yeah, absolutely. So you really want to look for a moisturizing cream as opposed to a lotion. A cream is going to be much more hydrating. You want to avoid moisturizers with any type of fragrances. You want to look for moisturizers that have ingredients such as colloidal oatmeal, as these are going to be more geared towards eczema. And then also pramoxine is a really good ingredient in a lot of moisturizers that helps with itching. It's also really important to be moisturizing after you get out of the bath or shower. Just kind of pat your skin dry and then really lather up to lock in that moisture. And my last tip is really good this time of year, especially when we're turning on our heats in our homes, and it just creates a lot of dry air. So putting a humidifier in the bedroom is another helpful tip for these patients.
Great tips and techniques. Dr. Jared Brackenridge, thank you so much. Very helpful.
Thank you.